my name is Cameron and I'm going to be your nurse today. The door is closed. I'm putting on my hand sanitizer, and can you go ahead and verify your name and your birthday for me?
Chris Fields, May 16th, 1997.
I'm going to check your wristband. Awesome. Okay, so today we're doing a musculoskeletal assessment. That just means I'm basically going to have you get up, move around, do some activities, get your joints moving, pun intended. So have you had any pain or muscle pain or joint pain or bone pain?
No.
Have you had any injuries to your muscles, joints, or your bones?
No.
And have any muscle stiffness, like any difficulty? And do you do a lot of heavy lifting at your
Sometimes.
Okay, and do you have any allergies? I think I might have already asked you that.
No.
And do you drink or smoke?
No.
Okay, well, we're gonna go ahead and get started. So can I have you stand up for me and then walk a few feet and come back and stand still for me. And the patient's posture is steady and erect. His shoulders are not slumped. He is standing with no difficulty. His gait was steady and even. His arms swayed opposite down by his sides. And please ignore the dogs barking. And we are going to go ahead and get started. So for this type of assessment, the equipment that I would need would be a tape measure or a genometer if I was going to measure the angles, but I'm not doing that today, so I do not need anything for this assessment. The patient's spine is symmetrical in the size and the shape. His cervical and lumbar spine does concave, while his thoracic spine is convex. I do not see any discoloration, swellings, masses, lesions, or anything. Is it all right if I touch you? Okay, and just palpating for clavicles and shoulders and your stenosis processes. And I did not palpate any.
You gotta chill.
Sorry, I did not palpate any pain, tenderness, crepitus, and I did not feel any abnormal heat. So can I get you to turn your chin down and look up? And the patient is able to flex and extend his cervical spine. Can you turn your head left and right? And he is able to rotate his head left and right and ear to shoulder. And he is able to laterally bend his cervical spine. Next, can I have you bend over and touch your toes as far as you can go, and you can stand back up. As the patient was extending and flexing his lumbar spine, I did notice that the symmetry of his shoulders and his iliac crests did remain symmetrical, as well as, I already said that. So now can I have you bend from side to side? And the patient can laterally bend his spine and twist. And the patient can rotate his lumbar spine evenly. So that is the spine. Next, we're going to move to the shoulders. I've already palpated and inspected the patient's shoulders, but just for clarification, there's no discoloration, swelling, masses, lesions. They are symmetrical in size and shape. I did not palpate any heat or crepitus or tenderness. And so now I'm going to step out of the way so that you don't smack me. Can you step this way so you don't smack the fan either? So I want you to put your arms down by your side. Move them up in front of you. Nope. Back. In front and back down. And now we'll move to that. So the patient was able to flex and extend his arms with his elbows straight. Keep your elbows straight. And bring them up above your head. Put your hands together. And bring them back down. And the patient is able to abduct and adduct his shoulders. And now you can bend your elbows and bring them behind your head. And now bend them and bring them behind your back. Thank you. And the patient is able to have full range of motion of, he has full range of motion of his spine and full range of motion of his shoulders. He was able to abduct, adduct, flex, extend, hyperextend, and bend his elbow, rotate his shoulders. So not his elbows, sorry. Patient does have full range of motion there. Now we'll move to the patient's elbows. So here I'm just gonna inspect your elbows real quick, and I do not see any abnormal discoloration, masses, lesions, swelling. They are symmetrical in size and shape. I'm going to palpate just below and above the olecranon processes and the epicondyles, and I do not feel any heat or crepitus or tenderness there. So to test the range of motion of your elbows, I want you to hold your hands out like this, bring them up, bring them down, and like you're gonna karate chop something, and flip them down, and flip them up. And the patient is able to extend and flex, or flex and extend his elbows, and he is able to supinate and pronate his elbows, which means that he has full range of motion. He did all of this with no difficulty or discomfort. Next, we're going to do the patient's wrists. I'm going to inspect my patient's wrists, and they are symmetrical in size and shape. There's no discoloration. I do not see any swelling. I do note that there is a ganglion cyst on his left wrist. I do not see one on the right, but that I will note in the documentation. And I'm gonna do what's called just palpate for any pain or tenderness here. And no pain or tenderness. I did not feel any heat, pain or tenderness, or crepitus in the patient's wrists. So now I want you to hold your hands like this, bend them down, and bend them up. Patient is able to flex and extend his wrists, and can you turn him out and turn him in? And he is able to radially deviate and deviate his ulna, to that. So the patient does have full range of motion of his wrists. He is able to extend, flex, and deviate the ulna and the radius. But now I'm going to do his hands and his fingers. So the patient's fingers are symmetrical in size and shape. I do not see any abnormal discolorations, no swelling or masses. I'm going to do what's called the squeeze test. This kind of goes for the wrist and the hands. Any pain or tenderness? And the patient was able to tolerate the squeeze test, no pain or tenderness. So I did not palpate pain or tenderness or heat or crepitus with any of that. Can I see I need to palpate your fingers real quick to verify that, since I didn't before. And yes, so I did not palpate any pain or tenderness or crepitus of his finger joints. So next, to assess your fingers, can you take your hands and bend your fingers down, put your fingers up, and can you separate them, bring them apart, and make a fist? The patient is able to abduct and adduct and flex and extend his fingers. Can I have you take your thumb and cross it over to the base of your fifth finger, and pull your thumb away from your hands? And the patient is able to move his thumbs and away from his fingers and towards his fingers. Next, we're going to do your hips. This one is a little bit different, so you're going to have to sit down for me, and you're actually going to have to lay down. So we're going to put the foot thing up here, and will you uncross your feet for me? So for this part of the assessment, I would have the client remove his gown, but since he's not wearing one, I'm not going to have him do this today. But if I did, I would inspect the patient's hips for discoloration, mass, tenderness, mass, swellings, anything like that. His hips, I can tell you, are symmetrical in size and shape, and his hips are stable. As I noticed as he was doing his gait. To palpate his hips, I would palpate for pain or tenderness and temperature and crepitus, which I would not palpate any of this on this patient. So now I want you to keep your knees straight and bring one leg up into the air as far as you can go and down, and the other leg knees bent straight. There you go, and down. The patient is able to flex and extend his hips with the knees straight. So now I want you to do the same thing again, but bend your knee this time. Bring it as close to you as you can, and then down, and thank you. The patient is able to flex and extend his hip joints with his knees bent. So now I want you to prop your one knee up just wherever, and bend it as far as you can that way, and back, and down. Put your foot down, do the same thing on this side, okay, and down. The patient is able to rotate his hip joints. He did rotate his hip joints bilaterally, so now put your feet straight, put your legs straight, and whichever leg you want to do first, take one, keep your knees straight, your knees straight, and pull it as far away from your body as you can, and do it this way as much as you can with the armrest here. Perfect. So the patient is able to adduct and abduct his hip joints, and lastly, this one's going to be a little bit awkward for you. Can I have you roll over? Thank you. And keep your knees straight and pull one leg up in the air as far as you can, and down, and the next one. And down. Thank you. You can roll over and sit up straight. Thank you for participating there. The patient has full range of motion of his hips. He did all of that with as the least amount of difficulty as he could. Flipping over was a little bit hard on the steady surface, but he had full range of motion of his hips. He was able to flex and extend the hips with the knees bent and the knees straight. He adducted and abducted them as far as he could, and he was able to rotate his hips as well as flip over in the pronation position and hyperextend his legs with his hips with his knees straight. So next I'm going to assess his knees. So the patient's knees appear to be symmetrical in size and shape. There is no discolorations, masses, or lesions. I'm just going to be feeling your knees now. Do not feel any pain or tenderness in his knees. I did not feel any crepitus, and nor have I felt any heat in his knees. So for this, it's actually very easy. So can I have you stand up for me? Stand on one foot and bend your knee up and put it down, and do the same thing in the other one. Awesome. The patient has full range of motion of his knees. He is able to extend and flex and hyperextend his knee joints without any difficulty. So you can now sit down, because I'm going to lastly check your ankle joints here. So the patient's ankles are symmetrical in size and shape. There are no discolorations, masses, or lesions. And your feet, really, I'm going to be doing the squeeze test on your feet. Just any pain there. Feel for any pain or tenderness. And then check the toe joint. Sorry if it's ticklish. I do not feel any, did not feel any pain or tenderness. As he stated, there was none. And I did not feel any crepitus or heat in the patient's toes. So between his metatarsal joints, whatever they're called. So next I want you to take your feet, and can you pull them up for me and push them down. Patient is able to dorsiflex and plantar flex his feet. Can you turn them out and turn them in? Patient is able to abduct and abduct his feet and turn them in and turn them out. And he is able to tilt them, invert and exvert his feet. And can you flex your toes, point them down? And the patient is able to flex his toes and extend his toes. So I do believe that wraps